Hey everybody, it's 10 o'clock. There's a few more people that are joining the room, so we'll give it just a couple more minutes. This is the Community Cafe for April. I'm Stephanie Robbins. Glad you're here this morning. Okay. I've kind of slowed down. Topic this month is intellectual developmental disabilities, IDD. We've got some wonderful panelists this morning, some good topics, I believe. Going to take care of some housekeeping. The chat box is always available. Would love to hear some interaction, just unmute yourself and speak up. The speakers are going to present. We'll give a little bit of time after each person to ask a couple of questions, and then we'll open the floor at the end of everyone to ask more. So it might be best if you have maybe a little bit more you want to discuss to wait till the very end. Some of these are going to kind of segue into another topic, as you'll see. And if there's any questions, of course, that we don't have the answer to, or that may take a little bit longer discussion, we welcome those. We may get your information and let you speak directly with that panelist, or devote a little bit more time and call you back later or have you call in. But we certainly welcome comments and questions. I don't think we have anybody here that needs special accommodations for closed captioning or language, but if you do, please put it in the chat and we will make sure that that happens. We do have someone monitoring the chat, so feel free to use that if you don't feel comfortable speaking out. But again, please do that. And please feel free to put your camera on. We'd love to see some interaction on that as well. So we have some folks from partners here as well. And then we have our panelists. So we will get started. Again, the topic is IDD, intellectual developmental disabilities. Some of the topics we're going to speak on today is innovations, the waiver, and the registry of unmet needs, some advocacy, some specific advocacy type actions and initiatives going on, and the PACE program, and we've got some wonderful speakers. So I'm going to start it off today. My name again is Stephanie Robbins, and I have been with Partners for a little over 7 years. I have worked with the intellectual developmental disability individuals and in that field for over 25 years. In different realms, I've been a job coach, I've been QP, I've done paperwork, I've been on the direct floor, when there was working in the ADAP and when it was called that. So I love working in this field. My most recent job before I came into the training field was as the registry specialist at Partners. So I'm familiar with that. I'm familiar with innovations. So as an overview for innovations, I'm going to look here. So as a kind of a definition and a summary, innovations is the way that North Carolina wanted to envision it and the way that they see it. And it is a home and community-based service. It's called a waiver. And it is for individuals with intellectual or developmental disabilities who want to get their services and support in their own homes and communities instead of in an institution. And that is the primary premise of it, is to keep people in their homes and communities rather than institutions. It is called a waiver. It's a waiver service because certain rules that are typically assigned for Medicaid recipients are waived. It's through an agreement with the federal government. Okay. Waiver programs give people more choices about what kind of Medicaid funded services they can get and where they can receive them. So basically, that's innovations. It's designed to keep people in their homes and communities rather than institutions. And it's called a waiver because certain rules that are assigned to Medicaid are waived. Some of the goals of the innovations waiver are they want to value and support the participants to be fully functioning in the community, okay? Promote promising practices that result in real life outcomes for the participants, not just keep them busy doing busy work, but to actually see them doing something meaningful, a meaningful day. A meaningful day for one person may not be the same for another. To offer service options that will help each participant have the ability to live in homes of their choices, to have employment of their choice, to engage again in a purposeful day of their choice, and to achieve life goals of their choice. Choice being the key word. To provide opportunities for participants to direct their services. Okay, there are direct services now. That's been an option and a big push for the last few years, self-directed services. And to provide educational services. So there's main goals for innovations now. It's not just a goal plan. Johnny will work 4 hours outside of the home. It's not just those simple goals. There's kind of an overview of goals now. There are services within innovations. They can look anything: community living and supports, day supports, respite, assistive technology, home modifications, residential supports, supported living, vehicle modifications, and there's more. And plans are created for a person that gets on innovations. So the eligibility, okay, for innovations. To be eligible for innovations, someone has to have a documented diagnosis for intellectual and developmental disability. And that means, and this is according to North Carolina general statutes, partners doesn't just say, oh, okay, you can have it and you can't. So this is diagnosed and documented. Significant intellectual disability or significant developmental disability. And a substantial limitation in at least 3 of 6 major life activity areas. Self-care, understanding, using language, learning, mobility, self-direction. They have to be eligible for Medicaid upon approval. So someone does not have to have Medicaid in order to be approved for the waiver. Okay, and there's a process for letting that happen, and you would find out more when you were offered a slot. The waiver is appropriate for them. Okay, those services are needed for them in order to remain in their home. And they live in a private living arrangement or a small residential where health and safety can be maintained with those services. And when you are on the innovations waiver, there are certain things that you are allowed and provide. You get care management, you get a care manager, who helps you create your plan and monitors to make sure you're getting the services you need. You help create that plan, you know, what services you will need. And then your care manager assists you with finding providers and whatnot. Okay. So how do you get to the waiver? And that is the registry. So I want to show you, I'm going to share my screen and show you the roadmap to the registry. See that? My roadmap.
Yes, we are.
Okay. All right. So this is very handy and some of our member engagement. Some of our member engagement representatives that go out in the community have been handing this out, and I think it's fabulous. I think I'm actually gonna move it over. Okay. So we do have our access to care line, always 24/7, 365 access to care, which is the 888-235-4673. Okay, and I don't know if it's in the chat, but someone can put it in our chat box. That's Partners 24-hour access to care. When you call that number, they will now refer you to the registry work group direct number. Partners has established a direct number specifically for the registry specialist. The registry of unmet needs is the wait list for the innovations waiver. The wait list is first come, first served. There is not enough slots in North Carolina or our catchment area for everyone who needs to be on innovations to be on it. So there is a wait list. It is first come, first served. You will not be passed because someone says, oh, Susie has more needs than Rebecca. It doesn't work that way. Okay, when you get up to the top, again, determination is made based on a psychological evaluation, which determines if you have the diagnosis, and then it's first come, first served. All of the people that are put on the registry it is date and time stamped, and it is in a digital system. And it is every time it is managed, it is touched, it is date and time stamped, and by whom. Okay. So you call in and you make an appointment for an intake. And that, by the way, is your registry date. So even if you make an appointment, you call in on April 27th at 10:14, but they're not scheduling until May 29th. So you're like, oh my goodness, it's a month. No, your registry date would still be April 27th at 10:14. Okay. So please keep that in mind. Don't let it bother you if you have to wait or if you have to reschedule. So you call in, you do have to be the legal guardian or have them with you. If you do call in and make an appointment for someone else, the legal guardian must be on the intake call at least, okay? Or if the member is the legal guardian, they have to be present to give permission to continue the phone call. All right. So yes, be prepared to be on the phone for at least an hour, hour and a half, because you're going to be completing the health risk assessment. So, yes, step 3, you will need a psychological evaluation, but your registry specialist can help connect you with an evaluator in your area. Okay, you can use whomever you want. Partners has a list of folks typically that will accept Medicaid and whatnot. Number 4, the health risk assessment, social determinants. You will do that on the phone with your registry specialist. You do not have to do that on your own. They do that on the phone with you. They'll check all the boxes, okay? The next, you will receive a letter with your date and time. That happens only after you send in the documentation, which shows that your loved one has the diagnosis. Okay. You are not placed on the registry of wait list for innovations until it is confirmed that your loved one has a diagnosis. Okay. Um, and then once you're on the wait list, you will not fall off. We make every due diligent effort to maintain contact with you, or of course you can reach out and contact us. You will be assigned a direct contact person, even if you are on the wait list for innovations. All right. And then if you do get on the wait list for innovations, you still may be eligible for some services while you're waiting. And those are called the B3 services or long-term services, depending on your age. Okay. We do have these that we will be able to email out, copies of these that we can email out. You're welcome to make copies of them, send them out to people that you know. All right. Again, we'll have time at the end for questions. The next speaker panelist is going to kind of follow up on this registry, the wait list. Are there any questions, quick questions right now or anything?
Stephanie,
Yes.
I was wondering if you could email that slide.
Yes.
That shows the path. I think that says so much in that slide.
Yes. Yeah, it is. And how are you, Miss Mitchell? It's good to hear from you.
Thank you. Great. Thank you.
Yeah, it's been a while. Yes, it is very informative. And yes, ma'am, this is the one that we're going to try to get out to everybody. Yes, ma'am.
Thank you so much, because that's really what we need to see. I feel like it's shared.
Yes, ma'am. All right. Well, thank you. Okay. Well, our next panelist is Celeste Graham from Amazing Grace Advocacy. And I am going to look right here. I have her. Celeste Graham. She is with Amazing Grace Advocacy. She has had a long background in education with the local school system, 15 years, in a variety of settings. She does have 3 children, one of which has special needs. He was internationally adopted and has a rare genetic disorder. Her job at Amazing Grace is the perfect place to combine her education experience and a life lived with her with her son who has special needs. Her job is to come alongside the children she works with on their journey, helping them to link with any resources for the supports that they may need. Okay. She works the job at Amazing Grace Advocacy. They work with families from birth to transition to adulthood. Okay. The children have a variety of brain disorders, including various disabilities, mental health difficulties, substance use disorders. And I will put the website address in the chat box. So I believe Ms. Graham's going to have us some really good information. Thank you, Ms. Graham. I'll turn it over to you.
Thanks, Stephanie. I appreciate that. I'm going to share my screen with you guys. I have a few slides. All right. So I was asked to share on behalf of Amazing Grace, and I'm going to start with my story with Levi, and then kind of lead into Amazing Grace. So Levi, he was adopted from Ukraine at 4 years old. He had spent his whole life in an orphanage. He was actually born in Luhansk, which is the area that was first occupied by Russia, and he was moved to Kharkiv in 2014 when the war first broke out. So not only do we have orphanage, neglect, and trauma, but now we have some trauma from a war breaking out. So this first picture on my left is when we were there in Ukraine and we first met him. We were told that he had cerebral palsy. And as a special education teacher, I knew there was more to the story. So we were there for 38 days and we finally were able to come home in July 2016. And so once we got home, in started the services, doctors. So he started at Mary Frances Wall in Cabarrus County, got him evaled and started with services there. We started private PT, OT, and speech. He had a hole in his heart, so we saw the cardiologist because he had cerebral palsy. I went to a neurologist who started doing yearly MRIs. We also went to teach in Charlotte, and I beat myself up because I was like, I should be able to know if my son has autism. And he actually did have an autism diagnosis, but more on that will come later. We also, through a family I had worked with and who had become really close friends, we found out about the Carolina Institute for Developmental Disabilities in Chapel Hill. And so we took him there and had a comprehensive evaluation. Because we received our AU diagnosis, we were able to start ABA in 2017, and which has been a great thing. So when the neurologist started doing the yearly MRIs, she decided to do a genetic panel looking at different causes for developmental disability while he was under sedation. And it actually came back that he had a variant of uncertain significance. And so we were referred to genetics. And I was like, oh boy. Genetics did follow-up testing, and it turned out that he has a rare genetic condition called creatine transporter deficiency, which the symptoms are intellectual or developmental disabilities, extreme impulsivity, hyperactivity, seizures, movement disorders, speech delay, AU tendencies or diagnosis, GI issues, muscle weakness, and failure to thrive. You can't really tell it in the picture on the left when he was in Ukraine, but he was a tiny, tiny peanut. At 4, he was in a group in the orphanage of probably 18 to 24-month-olds. And he had just been in that group. So a lot of these symptoms definitely pointed to his genetic condition. And I, as a special education teacher, thought about all of the kids I've interacted with over the years who have had an intellectual disability and maybe a diagnosis of AU or some seizures or, but that haven't had a specific diagnosis. So what his is his body makes creatine. It's just not able to deliver it to muscles and organs and areas in the brain that it needs to go, which results in those symptoms. The other picture on the screen is Levi now. He'll be 10 on actually tomorrow. And so he is nearly doubled, tripled in size. He is loving life right now and just loves to explore. All right. So a little bit about me and my background. I have my bachelor's in child and family development, BK licensure from Charlotte. I have my master's in special education, K-12 from Western Carolina. Ever since I was in middle school, I volunteered with kids with special needs. I did some ABA verbal behavior tutoring throughout college and a little bit after. I taught for 15 years. I've done EC pre-K, more at 4. I actually opened the day treatment classroom in elementary school in Cabarrus County when they split that up. I've taught resource in elementary and inclusion in high school. I've supported special needs programs at church and on mission trips. And then my life with Levi. So our life changed drastically in 2016 when we brought Levi home. And now I'm involved in the rare disease world as well. Levi actually does have a waiver slot. We petitioned for and had lots and lots of data and information and got an emergent slot. And so we're very thankful for that. I'm not sure what we would do without it. But all of that said, combines all of that kind of leads me to Amazing Grace. So I had my third child last April. And, you know, the schools, it takes a lot out of you. So I was kind of looking at my different options and my passions. And that kind of led me to Amazing Grace, which is a good combination of all that for me to be able to work with families. So what is Amazing Grace? We are a nonprofit organization. Gwen Bartley is our founder. She founded Amazing Grace at her dining room table. Our focus is on undiagnosed or diagnosed brain disorders, including intellectual disabilities, autism, mental health illness disorders, childhood trauma, substance use, and other neurological disorders. We offer services birth to transition to adult. And our goals are to come alongside families in their journey. A lot of times we get families who are in crisis and just don't know what to do next or where to go. So we, all of the navigators have, and Gwen, we all have lived experience in a lot of different areas. And so we help link to a variety of resources. We establish a lot of positive partnerships with school systems and medical providers, with MCOs. And so we just try to kind of come around them and help them figure out a direction. And we continue to support them wherever needed, whether that's attending IEP meetings at school or, you know, working with providers to get what they need, Medicaid and all of that. There are navigators, and then there's a board of directors. They're all parents, caregivers, and patients of those with various brain disorders. We all have, like I said, a variety of lived experiences. The cost, it's $25 an hour. There is a sliding scale, and Gwen has done an amazing job of securing some grants that help out as well. So we do what we can to help as many people as we can. We also offer some events for kiddos and young adults. There's a job skills junction, some etiquette stuff, social skills classes. And then for parents, there's come to the table events, which is just a time to get away and just kind of focus on ourselves. And then there's various presentations and webinars. Like recently we had one on neurodevelopmental movement and neurofeedback. And then there's cohorts and support groups that we have as well. So with that on the screen, there's our connect at amazegraceadvocacy.com email. If you have any questions or want more information, feel free to email that, as well as our website, amazinggraceadvocacy.org.
Okay, thank you so much. Does anybody have any questions or comments?
So there is a question.
May I ask,
There is, yes. ABA therapy, alternative behavior.
ABA therapy is applied behavioral analysis
Applied
therapy.
behavior.
Mhm. It's a therapy that focuses on working with behaviors.
Yeah, it's a research-based therapy, and it's had really successful results. It's typically done in the home, right, where they do a lot of research and identify target behaviors with a lot of parental input, and they'll do a lot of, it's really target-based, where they will and data-based, right? They will do specific techniques and get a lot of parental involvement to work on those techniques, right? And
take a lot of data and
right, specifically manage the data. Is that what you would say?
yeah. They can also be clinic based. There are a few clinics that have opened up in Cabarrus County.
Okay. And it she also says, what does it focus on? Would you say it's primarily for children that have been diagnosed with autism, or just behaviors in typical, or what would you say?
So in the state of North Carolina, you can only really afford ABA if you have a diagnosis of autism. There are a lot of groups that are working to change that because we know that it can be effective with a lot of kiddos that, with additional diagnoses. But yeah, and the company works with the family to determine what behaviors, they want to target and then help the child move forward.
And it's a Medicaid funded. Medicaid can pay for it. Mhm. If it's written, from a recommendation. Are there any other questions? That's good. There's a lot of ABA providers now that have put limitations on who they'll accept. Some people don't even accept higher than 8 years old. So the push is to get them in really young. Okay, very good. All right, our next panelists are from an action group, an initiative called Too Long to Wait. And they are making a big splash. And I remember when I was a registry specialist, I would tell a lot of the families I worked with about this, this movement. The flyer is, it streams across our banner on our public website, partnersbhm.org. Too Long to Wait. We have Sarah Potter and Bill Donahue, and Bill has his wife with him, I believe, on screen. So I'm going to let them share, and whenever they tell me to, I'm going to put the flyer on the screen. But let me tell you a little bit about both of them. Bill, he has an adult son. I think he's 35. So he and his wife have lived experience with their son. And Bill has been on the board with the ARC, with Disability Rights of North Carolina, and with the CFAC advisory. Ms. Potter, Sarah Potter, she also is a mother, an adult son with a disability. She's a strong advocate, and the Donahues have also touted her experience and complimented her. Says she's an advocate not just for her son but for all. She's really the glue that holds this initiative together. The Too Long to Wait. She is really good at monitoring a lot of what happens in the state. This initiative is regarding the Registry of Unmet Needs, by the way. She is currently a partner of Partners CFAC, and she can tell you what that is, Family Advisory Committee, okay? And she is on currently both the Triads IDD Advisory Committee and their Mental Health Substance Use Advisory Committee. So I'm going to turn the floor over to Sarah Potter, and I think Bill Donahue is here as well, but I think Sarah's going to do primarily most of it. And Sarah, you let me know when you want me to put the flyer up, okay?
Okay, thank you.
Thank you.
I'll start by just giving a little history of our North Carolina Waiver Action Team, better known as NC-WAT, because we all have to have an acronym. We've been at this for a couple of years now. It was the brainchild of Bill and Deb. It came out of our IDD advisory because of our frustration with no movement and not getting any slots in Forsyth County. We actually had more people on the wait list in Forsyth County than we did receiving services. Some on the wait list over 15 years. So we decided to start local and try to do something about it. IDD advisory started 40 years ago with Centerpoint and was funded by Centerpoint, and then we went to Cardinal, and it kind of disbanded until our county commissioner stepped up and gave us funding to start it back up again. And now Partners is helping us to continue. But we just really wanted to do something. It's a grassroots advocacy movement. And what we wanted to do is try to gather grassroots momentum in addressing now close to 15,000 on the wait list statewide. Anyway, historically, it's just maybe we're grateful to our Senator Kravich for getting us about 1,000 slots a year, but that doesn't keep up with the number of people that register. So we've got to find another way to meet the needs and support parents that are waiting. We do have a website, which they will put in the chat for us, that covers the history of the waiver, frequently asked questions. You can sign up for our newsletter. There are stories, there are events. So I highly recommend that people will sign up to be part of us. We do have a Facebook page, which is the North Carolina Innovations Waiver Action Team Facebook page. Between our Facebook page and our website, we have close to 1,000 people following us, but 1,000 people is nothing for what we need. With 15,000 on the wait list, we hope to just garner support and really be able to make this a statewide movement. We did have a rally locally in Forsyth County that was well attended and covered by the press and the media. It happened to be the weekend before COVID broke out. So that was the end of our in-person rallies. But anyway, we hope to resume that soon. We're excited because we've just joined an initiative through a grant with the North Carolina Developmental Disabilities Council. It is with LAN, who is the Leadership Alliance Neurodevelopmental Disabilities Group. And we're working with other large agencies like the ARC, Disability Rights, First in Families, Autism Society, all the big hitters in the state. And what we want to do is take the next 4 years and educate and inform and support and families as best we can, and help inform legislators to let them know how families are suffering with the lack of support and having to wait so long and being unable to plan for the future of their loved ones. So we just would like to work with the legislators and DHHS and the DD Council and partners just to help collect stories, hopefully from all the 100 counties in North Carolina, so that it hits home with our legislators, to just let them know what it means to a family that's having to wait, 15 years for a waiver. So we really like people to join us. Something coming up soon. There is DHHS is asking for a new Medicaid waiver proposal called the 1115I waiver. There is 2 webinars actually coming up that is going to explain it. One is on Tuesday, May 3rd at 2 o'clock, and then Monday, May 9th at 3 o'clock. You need to register, but we're hoping that this is going to be an addition of support to families that are waiting on the Registry of Unmet Needs, because it isn't a Medicaid entitlement. It is to replace services under the B3 service. And I'm sure there's some people out there that have any idea what I'm talking about, but hopefully I can send the registration information that partners can share with you. It's important because there will be a public comment period, and the devil is always in the details, and they will want our comments from families. So it's just very important to follow what's going on in the legislature and DHHS in order for you to advocate and be able to comment on what your family goes through and what you see the needs are. I will put a couple of other websites in the chat. One is the I2I Center, which has wonderful legislative updates and projects and events that are going on. They're very informative. And then in order to find out, you need to make a friend of your legislator and get to know them and build a relationship. But I will put that website in the chat, and you can look up your legislator and start building a relationship with them. we need to recruit members because we really need stories to help the legislators understand what we need. And if you have any questions, please ask, and we can give our contact information, or it is available on our website. Thank you. And I'll ask Bill and Deb if there's anything that I left out that they would like to add.
I think the only thing I would add is that the key word in our website and our Facebook is action team. And one of our biggest challenges is the gap between awareness and action is huge. So, but it begins with action, learning about the registry, learning about the process, getting a networked forum in your local community, getting to know your legislators. And you can get plugged into all of that by signing up on our registry of unmet needs, the North Carolina Waiver Action Team. And we really appreciate partners and this kind of banner that they put up to inform people. But if you think 10 or 15 years is too long to wait for the development of your child or loved one or neighbor, you're absolutely right, it is. And we need to take action. Sarah's the best. Thanks, Sarah. We get, by the way, we get phone calls all the time from people who are not on the network and those who are on the network. And the questions just keep coming. The stories are everywhere, and all 99 county legislators need to know about them.
Do you put in the chat who our legislators are for our area, or where we could go to find out who those are, so that we could reach out to them, or whomever would like to could reach out to them?
Stephanie, I'm putting it in the chat right now.
Okay, thank you. Does anybody have any questions or anything else, comments or anything? Because it is important. It may feel very insignificant. You may feel like one person, but it is important to reach out to your representatives. That's one thing that our CEO, Rhett Melton, says to us, is even for us to tell our families that we talk to is, to be heard, to speak out if that's, what you want to do, because it can feel frustrating, very frustrating. And when I worked on the registry as well, I would hear from families. And I would say, even though you may feel insignificant doing it, it'll make you feel powerful if you can put it in words.
Most of us believe that every significant change in the history of developmental disability awareness and services began at some mother's kitchen table. And it's the beginning of networks, and we need our networks everywhere to reach out and be a voice. So get on the phone, get on the email.
Yeah. Very good. Anybody else have anything? Thank you so much. I have spoken of your flyer here and you guys many, many times, so I'm so glad to have you guys here. All right. So this is the next speaker we have, panelist, is Brittany Kearney, and she is with the PACE, P-A-C-E waiver program. And I also mentioned this to a lot of folks that I talk with, and I think this waiver program is wonderful. I'm very excited to hear more about it. Brittany is currently the president of the Charlotte Village Network. It is a network of volunteers. They work with folks that are 55 and older, and they want to stay in their home. And these are volunteers that help support individuals 55 and older that want to stay in their home. She's the president of that Charlotte Village. She also has an MDA in healthcare management. She has a master's in gerontology. She's an adjunct professor at UNC Charlotte. She's been with her local PACE program for 3 years. She leads a group called Focus in the Charlotte area. Focus stands for Fellowship of Communities Uniting, and that has about 700 volunteer members or community professionals in the Charlotte area that come together to provide care on behalf of, provide some sort of support to seniors. That's over 700 professionals. That's impressive in my eyes. She's been leading that group for over 8 years. So everybody, this is Brittany Kearney, and I open the floor to her to speak about the PACE program. Welcome, Brittany.
Thank you so much. It's a pleasure to be here today. And LaQuisha, thank you so much for the invite. Bill, I'm right there with you. I believe that networking is a huge aspect of being successful in anything that you're trying to do. And as Stephanie was just touching on, the focus group, for one, is just individuals who are working with in some sort of way on behalf of seniors. And it just keeps growing and growing and growing. So we get our word out and network that way. But today I definitely want to talk about PACE. It sounds very much so like the Innovations Waiver Program, but on a scale that is just 55 and over. So I'm going to share my screen and we'll get started with a high level overview. If anyone's interested in learning more, you can absolutely reach directly out directly to me. But the benefits of PACE, we'll talk about what PACE is first. It's a comprehensive program providing services to seniors, and this is across the entire continuum of care, everything from preventative medicine through end of life. And because we are funded through Medicare, Medicaid, or private funds, there's no traditional fee-for-service package here. There's no insurance red tape or insurance saying, well, you don't qualify for that or you need a referral. If our seniors need the service, we're going to provide it for them. And full risk capitation program, meaning we receive the funding from Medicare, Medicaid, and we have to meet all of the needs of our participants within that amount to be successful. So preventative care is most definitely our focus. So for our seniors, they really want to stay living at home. They want to receive the services that they need to be supported at home without having to make sacrifices. So we have a team of individuals. I'll show you, it's an 11-person panel that helps coordinate all of the care and services for the senior. There's never a deductible or co-payment for our PACE beneficiaries. So once they're in the program, they don't have to pay anything out of pocket for any of the services that they receive, unless it actually does lead to placement in a nursing home or another type of long-term care location. And as I mentioned, we're approved Medicare, Medicaid plan. The eligibility for this, 55 years of age and older, they need to have nursing home level of care eligibility. And it sounds very much so like the waiver. It's mainly needing some type of support with activities of daily living, or maybe there is a chronic disease diagnosis, or maybe they're living with an intellectual or developmental disability and they need some support with activities of daily living. We do provide care and services. Some of our participants are living with IDD. They have to live within our PACE service area. There are PACE programs across the nation. There are 11 PACE programs in North Carolina. Our PACE program just happens to serve Mecklenburg, Cabarrus, Stanley, and Union County. We are one of the largest PACE service areas nationally. And we have to make sure that the individual is able to live safely in the community without jeopardizing their health and safety if PACE services are implemented. So it doesn't mean, that maybe they are a little bit unsafe at home, but if we implement services through PACE, it would make them safe. Then they can definitely move forward with enrollment. This is the 11-person team that I was discussing a moment ago. So it's not just a single care manager trying to help coordinate services. We are both the provider and the payer. We have the doctors on staff. We have both physical, occupational, speech therapists. We have recreational therapists. We have an adult day health center. We provide in-home care. We provide transportation. We have a dietitian. If there's a need for meals in the home, we can send meals home. We have a pharmacy on site. We provide all medications for our participants, whether they are mailed to the home in a 30-day supply, or if the individual is coming into our center and it's going home with them. And all of this, like I said, isn't necessarily coordinated by the family or the individual themselves. Our team works with them to help coordinate all of the access to this care. So as I was just mentioning, some of the services that are provided, all medications, any supplies, durable medical equipment. A lot of the older adults or the participants in our program, they may need a walker or a wheelchair, or they may need incontinence supplies or diabetic supplies. And the PACE program provides all of that. There's no out-of-pocket cost to the participants. And I think one of the things that's highly underappreciated is just the social activities aspect. So even if an individual isn't coming into our program for the adult day health component, we still have social activities that go on. We have virtual capabilities so people can get on Zoom. They can participate in our chair yoga. They can participate in Tai Chi. They can see what's going on in the day center through some technology that we were able to obtain through the pandemic. And they can interact with others from the comfort of their home. We were able to become very flexible during the pandemic. We got our home care license, our home health license. So even services that we were typically only providing in the center before, like in the medical clinic, we can go do in the home. We can have our RN, our nurses go out to the home. We can have our therapy team go do the therapy, whether it's physical or occupational, in the home. So we are very excited about the transitions here. And then just to show you, this is a map of other PACE organizations that are in North Carolina. It is absolutely a goal to have all 100 counties covered by a PACE program or a PACE organization. It's definitely with the Medicaid transitions and looking at how do we take care of and support dual eligible through a Medicaid transition. Definitely looking at PACE as a solution for that. But you see ours is in the green down towards the bottom. These are our service area here. And then I'll pause there. Does anyone have questions? Very high level. There's no wait. Oh, let me touch on that really fast. There's no waiting list for our program. There is, just like the Innovations Waiver Program, though, a process that you have to go through to get qualified. And it's not necessarily us as a PACE organization saying, yes, you can get in. We have to get the approvals through the state. So there's assessments that have to be done, a health and safety to make sure that the individual is safe. And that has to get sent up to the state. We do work really well with Medicaid. We help individuals apply for what's called long-term care Medicaid. And then that's covered through PACE. And so we can help individuals apply for it. If they already have Medicaid in the community, the program's most likely going to be $0 because it's based on the income amount. And so just to throw a number out there, $1,074 is what individuals are able to keep. If they make more than that, but still qualify for Medicaid, then they just pay the difference. So if they make $1,100, they'll pay $26 a month, and all of their healthcare needs, transportation, medications, everything is covered. I'll put my contact information, my email and my phone number and our website in the chat for you guys.
Yeah, there's a question in there about what is the contact number. And Martha, that could depend on what area you're in as to what the contact number is that right, Brittany?
Yes, so if it's going to be within our service area, then yes, you would call this number, and I can put another resource in there. It's the National PACE Association has what's called a PACE Finder. Everything is based upon zip code, and you can go to the PACE Finder. So say you have a family member, or someone that lives somewhere else and is interested, you can plug in the zip code, and if they do have a PACE organization servicing that area, it'll give you the contact.
Can you put that map back up with the regions? And that map there, do each of those colored regions, for example, do each of those have a different phone number, for example?
They do.
Okay, I see.
Yep, they do.
And you said, of course, you hope the whole state eventually is covered. So possibly those could expand or just new offices would open.
It'd have to be, the state would have to approve expansion. And as we know, getting the state to do things can sometimes be a barrier. So hopefully though, with them trying to figure out how to do the Medicaid transition for dual eligibles, hopefully PACE across the state would be an option.
Is IDD a requirement?
It is not, no. A lot of the individuals that we serve, maybe just, they're not necessarily IDD related. Some have diabetes, some are living with dementia, some don't necessarily have too many chronic illnesses, but they just have difficulty with activities of daily living. They could be a high fall risk.
Would IDD prevent someone from being accepted?
It would not, no, absolutely not.
Okay.
Yeah, we have individuals already in the program that have IDD. And so and every single participant in our program has a different plan of care. And what that looks like is depending on what the individual wants for themselves, and what their needs are. So we can cater a plan to make sure that we meet their needs.
Right. Okay, well, it is just about ending time. So Elizabeth has a question. And if anyone needs to drop off, that's understandable. I have time to stay. So Elizabeth asks a question, what would it look like for a family of 4, the parents being 80 and the 2 clients with IDD over 50? And Elizabeth, you may, if you're comfortable, you can unmute. If you're asking that question specifically for the innovations waiver, for getting on the registry, for PACE, specifically for all of it, or you can type it in. What specifically are you talking about for that question?
This would be a question for PACE. I have an individual on my caseload. The 2 daughters are over 50 with IDD disabilities, and both of the guardians are the parents, and they're over 80, and they currently have services for just geriatric type services, helping daily living stuff like that. But the 2 daughters, they all want to try to stay together, but they all 4 need that type of service, but in different levels, if that makes sense.
Yeah, so I know you said that they're over 50. Would they happen to be over 55?
Yes, both the daughters are.
Okay, yep. So we could customize a plan that would meet each one of their needs differently. Maybe, if someone needed an adult day and maybe none of them need that. They just need transportation and support and primary medical care in coordination with specialists or other providers. Do you want to give me a call? I'm going to put my cell phone in here if you want to give me a call directly.
Yeah, I'll definitely do that. Thank
I'd
you.
love to talk through that with you.
And then, let's see, Elizabeth, just out of curiosity, do the two children with IDD, are they on the registry of unmet needs for innovation by any chance?
They are, both of them have B3 and they've been waiting for a very, very long time. I honestly hope at the end of the year, the first of the year, they get a waiver slot because they have been on it for a very, very long time.
So then my question is, I don't think in North Carolina you can use 2 Medicaid waivers at the same time, but then they wouldn't have a need, I don't suppose, to go to the PACE perhaps day program and then an innovations day program. But if they're getting a B3, are they using a B3 like LTCS bundled service or anything day program?
Currently, they just have periodic respite and they used to have supportive living low, but they have to move back in with the parents. And so currently they just get very basic, maybe some personal care and periodic respite. But both of the guardians are well over 80 and declining fast, and they need help of their own. So it's just not a very great situation, unfortunately.
My understanding is that the waiver is for the individual, not the family. And I would hope that that family wouldn't be limited in the number they got.
Well, right, yeah, if the waiver was for the 2 children, correct. But if she's talking about using PACE for the 2 children, then. But until they got the waiver, then yeah, they can use PACE. The innovations. Mm-hmm. Yeah, you can mix and match. Any other questions or anything? That was a good point.
I see a question in here. How long does the process take to get qualified for PACE? If they already have Medicaid established, the process is fairly quick. We can get it done within 15 days. We can only enroll on the first of the month though, because we're considered as an insurance provider. It can only start on the first of the month. And then it's voluntary disenrollment at any time. And so if, as Stephanie was saying, if they became available for the waiver and needed to disenroll, they would disenroll at the end of the month and just do that transition.
Whenever that does happen, for example, if somebody's on a waiver with DSS and they want to switch to us, they always coordinate so there's no lapse in service.
Mm-hmm. Yep.
Okay, very good. If anybody else has any questions or they want to talk to anybody about anything else, I think everybody's number is in the chat box or email. You can always reach out to somebody on our panel, myself, Abby, Cole. All of our emails are our first initial last name at partnersbhm.org. We'll be glad to give you information if you didn't catch it on today's cafe. Next month is May. The cafe will be on May 25th. The cafe is always the 4th Wednesday of the month at 10 o'clock. Right now, my understanding is that it's going to be mental health awareness. So we look forward to seeing anyone and everyone. Please tell everyone that you know that the cafe is always the 4th Wednesday of the month at 10 o'clock. We thank you so much for being here today. We hope you have a wonderful day and come join us again. Thank you all.
Thank you.
Thank you, Stephanie.
Bye-bye.
Thank you.